Well, good afternoon and welcome. I'm Rich Clarida, the Lowell Harris Professor of Economics and International Affairs here at Columbia, and a faculty affiliate of the Institute for Global Politics. It's really a pleasure to moderate today's IGP Rapid Response webinar on a topic that could not be more timely or consequential. We're here today to discuss and assess the federal budget bill that is working its way through the reconciliation process in Congress, and what the likely passage of the bill later this year would mean for the tax code, budget deficits, and the growth in spending on prominent entitlement programs such as Medicaid and supplemental nutrition assistance, among many other elements of the bill. To help us unpack these issues, I'm delighted to be joined by a truly outstanding panel of scholars and practitioners whose expertise spans economic policy, public finance, social policy, gender rights, and political economy. Let me briefly introduce them now in alphabetical order. First up is Alex Herzl Fernandez. Alex is an associate professor of international affairs here at Columbia and a member of IGP's faculty advisory board. His research focuses on the politics of public policy. Alex previously served in the Biden administration in the U.S. Department of Labor and the White House Office of Information and Regulatory Affairs. Next up is my good friend since graduate school days, and also Columbia colleague of 35 plus years, Glenn Hubbard, who is Dean Emeritus of the Columbia Business School and the Carson Professor of Finance and Economics. Glenn also directs the Chazen Center for International Business. Glenn brings deep experience in fiscal policy, having served as Deputy Assistant Secretary of the Treasury under President George H.W. Bush, and as a very effective and influential chair of the Council of Economic Advisors under President George W. Bush. And I should also mention, given the topic today, that I served as Assistant Secretary of the Treasury for Economic Policy during those same years, 2001 to 2003. Next up is Jennifer Klein. Jennifer is a professor of practice at SIPA and director of the Women's Initiative at IGP. She has served as White House Gender Policy Council Director and brings extensive expertise in public health, gender equity, and social policy. We're thrilled to have her perspective today on how the budget could impact working families in vulnerable communities. Next up is Jack Liu. Jack is currently Professor of International and Public Affairs at SIPA and is IGP's Faculty Policy Director. In his distinguished career, he has served as the director of the Office of Management and Budget during both the Clinton and Obama administrations. He later served as President Obama's chief of staff and as the 76th Treasury Secretary of the U.S. Treasury, and of course, most recently as our ambassador to Israel. Jack's experience at the highest level of economic policy making gives him a unique insight into the broader fiscal and geopolitical context of today's debate. Last but certainly not least is Natasha Sarin. Natasha is a professor of law at Yale and formerly served with great distinction as Deputy Assistant Secretary for Economic Policy at the U.S. Treasury. Her work bridges the worlds of tax, regulation, and financial stability, and she'll help us understand the deeper economic implications of the bill's tax provisions and spending shifts. So we're going to begin with a broad discussion of the bill's priorities and political context, and then dive into the proposed tax cuts, changes in the social safety net, and implications of these potential changes for access to healthcare, nutritional assistance, among many other elements. I'll pose a few questions to get us started, and then we'll open it up for discussion and should have time at the end for some questions from the audience as well. So with that, let's dive in. Jack, we will start with you. You've argued recently that this budget could increase the debt by $3 to $5 trillion over 10 years. What does this budget bill signal about the policy priorities of the current administration? How does it compare to past Republican budgets, such as the 2017 Tax Cut and Jobs Act?
Thanks very much, Rich, and it's good to be here with so many friends and colleagues. You know, I've often thought about budgets as telling a story as opposed to being about numbers. I've described it, and I believe it's more of a tapestry than it is a table. This is a budget that would reshape the fiscal policy for the future, not change the direction, but take a fiscal position that's already very threatening to the long-term stability of our economy and just increase the progression of the growth of debt and deficit so that we would ultimately, in the foreseeable future, see our debt at 200% of GDP. I mean, there aren't a lot of countries that have debts that large, and it's not great company to be with a country like Sudan in terms of our debt as a percentage of GDP. You know, I wrote a piece this week in Bloomberg where I said this budget is upside down. On the one hand, you know, it reflects a desire to promote growth through tax cuts that can be defended in some regards on their merits, but it doesn't put it into the context of the overall fiscal picture, which can't support either the full extension of the 2017 tax cuts, or certainly not putting additional new tax cuts for business, for high-income individuals, even for working people, because there's not a mechanism to truly pay for it. The bill has in it, you know, about 20%, the bill that the House passed of the provisions paid for. You know, that's a drop in the bucket. So you start with $2.5 trillion being assumed not to cost anything because it's continuing 2017 policies, and then you pay for part of the things on top of it, and that's how you get to 3 to 6 trillion. The big difference is, do things that have sunsets expire, or do they stay and become permanent? My sad experience is that the sun never sets on tax cuts. They go on because it's too hard. Just like ending the 2017 tax cuts would be hard today, ending the new tax cuts that are put into place will be hard 2, 3, 5 years from now. And that's where I end up with the relatively large number. Plus, you have to assume there's interest on the debt that's building up. The thing about this budget that I find most troubling, and frankly is different than the 2017 budget, is that it really does target for savings the most vulnerable in our society. The 2017 bill didn't have a lot of those savings. One could say that by putting in the limitation on state and local tax deductions, when it looked for savings, it tried to take them from high-income individuals. This bill takes the savings from, you know, nutrition programs and healthcare programs, which I'm sure, you know, others are going to talk in detail about. But I've been troubled in the debate over this bill that those savings are characterized as waste and abuse, that people who shouldn't be on the programs are on them. But when you unpack it, it's the people who were covered in Medicaid because of policy changes in the 1990s and in 2009, because it was a way we closed the insurance gap to bring more people into coverage. So I think this is a very troubling budget. I think there is time to make it less harmful. I don't think this is a moment we need fiscal stimulus in our economy, and you and Glenn are macroeconomists will have more insight into that than I do. But to me, this is a moment, as somebody who spent a lot of my career on budgets, to say, slow down and ask, is this a direction we can really afford to go in? And I'm able to say, just watching the day-to-day debate, there are people in Congress, and the Senate in particular, asking that question. I just hope that they get answers that are serious answers.
Thank you. Great way to tee us up. We'll move right on. I should say we're going to hear from each of our panelists, and then later on we'll give chance for even more interaction. We'll go right to Natasha. Natasha, how would you characterize the macroeconomic impact of this bill on growth, debt sustainability, and inflation?
So Jack previewed a lot of the points I am going to make, but I want to try to put even some more numbers on this in ways that I hope are tangible. So if you take the bill as written, it's going to increase deficits over the course of the next 10 years by about $2.8 trillion. If you do, as Jack is rightfully doing, a bunch of how you're getting to that 2.8 trillion is you have a lot of these sort of budget gimmicks. You have these like no tax on tips, no tax on overtime that are sunsetting over the course of the budget window. So I think a true cost, as Jack is outlining, is more like something that makes those things permanent. That's about $4 trillion. Importantly, that higher, and this is work that my colleagues and I have done at the Budget Lab at Yale that I run, that higher impact of increased deficits over the course of the budget window. And by the way, those deficit impacts sort of matter even more in years 10 to 20 and 20 to 30 and 30 to 50 because of the interest costs associated with deficit financing. Those drive up interest rates. They increase the cost of government borrowing. That kind of makes sense. We're doing more borrowing, and so it's more expensive to do so. But importantly, and the connection that I think is really valuable to draw, those increases in interest rates are also going to be borne by households, right? So you're going to see higher mortgage rates. It's going to be more expensive to take out a car loan to buy a car or take out a small business loan to start your small business. And I also think a really important distinction to draw between this legislation that Congress is considering and the 2017 tax cuts, and I'm sure Glenn is going to talk about this as well, is this tax package is really not meaningfully about corporate tax provisions or investment-oriented provisions where there is empirical evidence that those types of tax cuts have investment increases, at least in the short run, and are a boost to growth. What this package is really about is it's about, and CBO just put out distributional tables earlier today, so hot off the presses. What this package is really about is it's about essentially a transfer, to the extent that it's financed at all, from those at the bottom of the distribution to those at the very top of the distribution who are going to see a very substantial increase in their after-tax and transfer income as a result of both the extension of the expiring provisions of the TCJA and a bunch of these new cuts. And so what we've shown in our work is that you're going to have a very tiny, a 0.2% of GDP increase in growth in the very short run from just like the fiscal boost. But that very quickly becomes a drag on the economy because of the fact that these aren't investment-oriented tax provisions and because they're deficit financed in ways that is ultimately going to be a drain on growth, not a boon to it.
Thank you so much. Very, very crisp and lot there. We'll move right on to Alex. Alex, what does the structure of this bill tell us about the internal politics and coalition dynamics within the GOP?
Thanks, Rich, and thanks so much for the opportunity to be part of this really important conversation. So I think the fights over this bill in its current form can tell us a lot about the current state of the Republican Party, including the ways that it has changed and not changed since the rise of Donald Trump back in 2016. Think of it as a moment where the tide pulls out and you can see some of the underlying tensions, but also points of continuity in the Republican Party. I think the first lesson that sticks out to me is that while Trump has transformed many aspects of the Republican Party, tax cuts for wealthy individuals remain one of the few points of continuity and glue that it holds the Republican Party together. Really, since the Reagan administration, we've seen Republicans in Congress use tax cuts, particularly for wealthy individuals and businesses, as one of the key pieces of glue to hold together their governing party. And I think it's incredibly telling, for instance, that the one red line where congressional Republicans pushed back on Trump hasn't been anything related to his flouting of constitutional norms or threats to democracy, but it was raising taxes on hedge fund managers. That was the one place where Trump proposed potentially curbing preferential tax treatment of the income that hedge fund managers and other investors receive. And, he got slapped down by congressional Republicans who said, absolutely no way. So tax cuts on the wealthy continue to be one of the pieces of glue that hold together the GOP coalition as much as Trump has changed it. The irony about that pushback from congressional Republicans is that Trump actually had a characteristically good political instinct to cater towards more Americans, that raising taxes on hedge fund managers is a broadly popular idea. And that stands in contrast to how the bill itself is polling right now. I just was looking at polling from yesterday from Quinnipiac that shows that a majority of Americans are opposed to the legislation, and even more become opposed when they learn just how upwardly tilted the tax cuts are and how much they're being financed by cuts to popular social programs. The fact that this is the signature legislative priority of this administration, I think, is indicative of a more general trend that we've seen in the first Trump administration as well, which is the kind of priorities that congressional Republicans and Trump are pursuing are not intended to appeal to majorities of Americans most of the time. Although this trend was emerging before Trump took office, I think it's being solidified even more that the Republican Party in office is often catering to a much smaller set of interests and not a majority of the public. The last lesson that I wanted to draw out that I think this bill teaches us is around some of the tensions in the Republican Party coalition, particularly around how they represent their districts, the states, and communities. Now, political scientists traditionally think about members of Congress as taking votes on bills in ways that benefit their states and their districts. But that's not what we're seeing in this piece of legislation. It's not what the Republicans are doing. As other folks on this webinar will talk about, this bill is making massive cuts to social programs that many of the Republicans' districts and states rely on very heavily. Just take the example of Medicaid, for instance. The top 5 states that receive Medicaid funding from the federal government are disproportionately deep red states, states like Mississippi, Oklahoma, West Virginia, and Kentucky. So when we think about the actual substance of this legislation, it's actually imposing a big penalty on the districts, communities, and states that the Republicans are supposed to be representing. And so I think that poses a real puzzle to how we think about representation in Congress, particularly among the Republican leadership. So I think those are 3 insights that I'm taking away from the legislation about the state of the Republican Party right now, particularly in Congress. But I'm really excited to talk more about it with all of you and with the folks here on this call.
Thank you, Alex. Next up is Jennifer. Jennifer, how might Democrats or other opponents of this legislation strategically respond?
First of all, thanks for hosting, and thanks to all of you. I'm honored to be part of this group. I think, and you've heard some of this already, but I think that there are really 3 winning strategies here. The first is to make the direct connection between tax cuts and spending cuts, who wins and who loses in this bill. We've seen others point this out, but it's not an accident that the total tax cuts for the richest 5% of Americans who would benefit is about $1.6 trillion. And the total spending cuts, on the other hand, to SNAP and Medicaid is about $1.3 trillion. And I think that doesn't sit well with many, including, as you've already heard, Republicans and independents. So I think that's, number one is talk about who's winning and who's losing here. The second, and we've heard less about this in the public debate, is really digging into the details here. So, this big, beautiful bill is 1,038-ish pages. And there are many provisions that people don't even know about that are pretty controversial, including, as Alex just said, for Republican members and their constituents. I'll just give 2 examples. One is that, as Alex just said, many of the cuts disproportionately hit people in Republican states. About 80% of the rural hospitals that have closed since the ACA first passed have been in Republican states that haven't expanded Medicaid. They're already at risk of closure. About 300 rural hospitals are listed as being at risk of immediate closure, and that's without these proposed cuts. So I think, that's really important for people to note. And then there's things in this bill that actually don't have anything to do with the budget. One obvious example is that the bill would freeze state regulation of AI for 10 years in the absence of congressional action. And that doesn't obviously have budget, to me, it doesn't have budget application implications. We're actually waiting for the parliamentarian from the Senate to rule on this. But that's just, one example of, a thing that's in this bill that really shouldn't be there, even if you're focused on, truly changing the direction of tax or spending policy in this country. And then the third thing I'd say is that it's important to demonstrate the impact of the dollars that are cut from this federal budget. What's the real impact of these policy choices? And we'll talk more about this, but that's everything from the rural hospitals I just mentioned that are struggling. It includes women and children, in particular from low and moderate income families who lose access to health care. There's estimates that this bill would result in 100,000 preventable deaths. And of course, families already contending with high costs that'll have even a harder time putting food on the table with the nutrition programs cut. These, as Alex just said, these policies are not popular. A majority of voters oppose the bill. 59% of respondents oppose cutting SNAP. Kaiser Family Foundation tracking poll from recently said that fewer than 1 in 5 adults want to see Medicaid funding decreased. So I think as I said, the last point is really focusing on what the impact of these cuts will be on American families.
Thank you, Jennifer. And last but not least, Glenn, as truly a leading authority on U.S. fiscal and tax policy for 4 decades, you've been a longtime advocate for a tax code that boosts growth in a fiscally responsible way, supply-side economics at its best. Proponents of this bill argue that tax cuts will spur investment and job growth. Do you agree? And more broadly, how do you assess the supply-side elements of this bill?
Well, thanks, Rich, and thanks for including me. I'm going to give the classic economist answer to your question, which is yes and no. Yes, in the sense that expensing is very good for growth. But remember, in TCJA 2017, the big juice from corporate tax reductions already happened, and that's permanent. So we're just talking about now making expensing permanent, good policy, to be sure, but not in and of itself a sea change for growth. The sign's right, but not huge. I worry about 2 things going against it. One has already come up, which is the large deficits that are implied by this. Simply assuming away the tax changes by just saying, well, we're going to move to a current policy baseline, that is assuming the tax cuts are there, as opposed to a current law baseline the Congressional Budget Office uses, that doesn't really change the dynamic that we are doing large borrowing here. The second, not to get too much into the weeds, is the Section 899 provision against foreign investment. In a nation that depends on foreign capital flows to fund its investment, it seems like an incredibly unwise move. So yes, on the investment expensing, but I think there are things that go in the other direction. To me, a really interesting question is, could you have accomplished the basic growth goals here without the budget busting and without the Medicaid cuts? And the answer to that's yes. And I'm sure you could do it in many ways, but I'll outline a very simple one that would seem consistent with what President Trump's trying to accomplish. So suppose you replace the corporate tax with a cash flow tax. So you'd have expensing, which is what the president wants, and you disallow interest deductions, also much of the thrust of the 2017 law, but you make it border adjustable, meaning you would deny deductions for imports, but not tax exports. That's the way value-added taxes, for example, or state sales taxes work. If you did that, the revenue you would raise from border adjustments, because the U.S. is a net importer, are enough to fund much of the deficit here. The rest of it could be funded by not letting the top rate stay low, that is, let it revert back to its 2016 level. So you could accomplish growth. You could accomplish what the president talks about in America First, because the border adjustments themselves would remove multinationals' incentive to move either real activity or profits outside the United States. So you could do what the administration wants without busting the budget. I don't think that will happen, but if members of Congress decide that they're sufficiently concerned about the deficit, it's worth a look. The other thing I would say before wrapping up is that this tax discussion is probably the last we can have without talking about fundamental tax reform and budget reform. We're at the end of the line. And I think it's clear from all the discussion. And if we're going to be serious about America's fiscal position, we need something bigger than tinkering with the present tax code. But I'll leave it there.
Fascinating. Thank you. So that concludes our first round where we've heard from each of our distinguished panelists. Now we're going to drill down a little bit. And in each of the next two segments, I will call on specific panelists, but I'll give others a chance to chime in if they have something they'd like to say on that topic. So, Natasha, I think you spoke a bit earlier, but maybe you can elaborate more on the distributional effects of the bill, and in particular, because there's a very big both tax and entitlement piece to this. Probably both are relevant. So maybe you could give us a little bit more of color on this topic.
Yeah, and maybe to do so, I will draw on what the Congressional Budget Office put out today, which
Perfect
was
timing.
it's very perfect timing just for this panel, which was its distributional analysis of sort of in aggregate from the bill, the winners and losers of the package. And we've kind of already touched on the pieces that are the most relevant, because on the tax side, you're seeing broad-based tax cuts through the extensions of things like the expiring individual side rate cuts that the 2017 law offered. But you're also seeing even more concentrated cuts that benefit the top, because it's things like the 199 cap A provision that deals with income that is earned by partnerships is being expanded from its current low rate to an even lower one. And so the result of that is a tax package that is sort of pushed towards the top of the distribution. And to the extent there are financing pieces here, they're coming from about $800 billion of Medicaid cuts. So that's the bottom and middle of the distribution. That's the bottom of the distribution, sorry. And it's coming from about another $300 billion of cuts in food stamps, and some expiring of things like the IRA tax credits for the clean energy transition. And there's also estate tax provisions in there that make the estate tax more generous. CBO and JCT didn't distribute everything I just laid out, but they did the main provisions of the bill and came to the conclusion that over the course of 10 years, obviously there's sunsetting and expiring of particular provisions. It takes a little bit of time for the Medicaid work requirements to kick in that are in the package thus far. But they concluded that by the end of 10 years, about 80% of the benefit from this budget bill is going to accrue to the top decile, and the bottom 40% are actually going to pay more or are going to face a decrease in their after-tax and transfer income because of what we're doing to Medicaid and to SNAP. And I think that in some sense is important. It suggests that for the bottom decile, their after-tax and transfer income is going to go down by about 4%. For the top decile, it's going to increase by about 2%. That is in what we're actually in the process of doing and putting out later this afternoon at the Budget Lab, is taking that impact and then also layering on the impact of another really important piece of economic policy that this administration is pursuing with tariffs. And tariffs are a consumption tax that's disproportionately borne, again, by the bottom of the distribution. Tariffs are slated to raise about $2.4 trillion over the course of the next decade if these tariff rates that are at very high levels stay in place. That, again, is going to mean a decrease in after-tax and transfer income of another about 3% for the bottom. So in aggregate, they're seeing their after-tax and transfer income as a result of this administration's policy choices decrease by about 7%. And I think that distributionally is sort of a complicated maze for them, and others on this call are much better, or on this Zoom are much better suited than I to comment on the politics of this. One piece I want to sort of plus one, though, in this discussion Rich, is what Glenn just said, like about the importance of having like a serious conversation about tax reform and about spending and about the nature of our fiscal position over the course of the next decade. There's a lot of challenges that we're not even going to get to discuss in this panel that have to do with the fact that the Social Security Trust Fund and the Medicare Trust Fund are set to extinguish over the course of the next decade. And like nothing in this package, no version of anything in this package, nothing about DOGE, none of it is getting us towards being able to address that question seriously. And I think it's like a first order one for our nation's finances and for our national security.
Definitely planning to come back to that if we have time, Natasha. I think what I'd like to do is hear from Jennifer and then Alex, and then after we've heard from them, we'll reserve time for other folks to weigh in. So Jennifer, the proposed changes, some of which Natasha just alluded to in Medicaid, could leave millions of Americans without coverage. And obviously there are similar proposals in the House bill that would directly impact the nutrition program. So what would be the practical consequences for working families and the public health system were these changes to become law?
Starting with healthcare, more than 15 million Americans would lose access to healthcare. According to the estimates from the Congressional Budget Office, the bill would decrease Medicaid spending that would result in nearly 8 million people losing Medicaid coverage alone. And then 4 million people would become uninsured due to Affordable Care Act marketplace cuts. And about a little bit over 4 million people would lose their coverage because the proposal fails to extend ACA subsidies. So as I said earlier, we've already seen estimates that this is likely to cause 100,000 early deaths over the next decade. Nearly 600 health clinics, especially in rural areas, will face closure because of these cuts. And, embedded in your question is a really good point, which is this will have an immediate impact on the health of individuals and families. It's also going to have long-term consequences for our public health system. Another point of particular concern for women in this budget, I'll just mention, is the defunding of Planned Parenthood by blocking Planned Parenthood from billing Medicaid for any health service. So that includes contraception and wellness exams, other preventive health care, cancer screenings. So remember that there's already a provision called the Hyde Amendment, which bans Medicaid coverage for abortions. So this is not about abortion. This is about other healthcare services that are provided by Planned Parenthood. And if Planned Parenthood is defunded, nearly 200 Planned Parenthood centers are at risk of closure. And that means more than 1 million patients could lose access to that full range of healthcare. Just a word on nutrition, as we've been discussing, significant cuts to nutrition programs. According, again, to CBO, this is the largest SNAP cut, if it were to come to pass, in history. It would cut about $300 billion from SNAP through 2034. By reducing the federal contribution to state SNAP programs, by expanding SNAP's work requirements, and ending SNAP for many people with a lawful immigration status. We know that SNAP is an incredibly vital program, particularly, again, for women and families. It's a 50-year bipartisan commitment to ensure that low-income Americans have the food that they need. And this is, for all obvious reasons, particularly important now as American families are struggling with paying for housing, for childcare, and other expenses. And finally, we also know that SNAP is a smart investment, which not only improves health outcomes, it reduces healthcare expenses. The latest estimate I saw is that for every dollar spent on SNAP for children, there's a $62 value over the long term. So it's not a surprise that strong majorities, as we talked about earlier, including independents and Republicans, oppose these cuts to both Medicaid and to SNAP.
Thank you, Jennifer. Alex, I'd like to hear from you again broadly on the theme of, again, if there could be a lot of changes between the House and the Senate bill in the final version, but if any of these rollbacks went through, the implications for inequality, workforce participation, intergenerational mobility.
Yeah, thanks, Rich. And I want to pick up where Jen just left off. I think Jen really articulated the harm that these cuts are going to have today and hinted that there's going to be a cost in the future. And I think that's really important because when we talk about safety net programs like Medicaid or nutritional assistance, we tend to think of them as costs today to help people in need today. But many of these programs, including Medicaid, including food assistance, we also know from rigorous economic research have long-term consequences on the people who receive them today. And that's particularly true for children and their parents. So we know that when children have the opportunity to be covered by Medicaid, when their parents have the opportunity to be covered by Medicaid when they're in their childhood, that they have better economic and social outcomes years into the future as a result of that coverage. The same is true for food assistance. They have better educational attainment outcomes, employment outcomes, and earnings as a result of that security, access to nutrition, access to healthcare, reduce stress from their parents that they encountered in their childhood. Let me give you some specific examples from some of the research on Medicaid that I found really persuasive that's at risk if we continue to see these very large cuts that were in the House legislation. Infants who were covered by Medicaid in their first year of life had lower rates of chronic conditions as adults, fewer hospitalizations related to chronic conditions, higher rates of high school graduation, college graduation, and employment. And one estimate says that children who are covered by Medicaid when they're growing up, when they're 19 to 28, the federal government recoups about 58 cents on the dollar for each dollar that it spends on Medicaid. And that's because those Medicaid recipients are more likely to be working, generating tax revenue, and are less reliant on safety net programs going into adulthood. So when we're talking about these cuts, they're actually not just imposing harms on people today. It's a drag on our productive capacity as an economy, as a labor force, years into the future right now if these cuts are maintained.
Thank you, Alex. And as promised, I'll give others a chance to weigh in on the broad topics that we've discussed, the details and some of the implications for inequality in different groups. So, yeah, Jack, please.
Rich, if I could pick up on something that both Glenn and Natasha said.
Yeah.
If this was a serious budget debate and fiscal policy conversation, it doesn't mean that you don't talk about how do you have taxes that promote growth. And it does mean that you'd have to talk about things like the financial survival of Social Security and Medicare. The kinds of policies that have popped up in this debate, some of them from the White House, some of them from the Hill, have kind of been the opposite of that. I mean, there was a debate about ending the taxation of Social Security benefits. That was something that was put into the bipartisan 1983 Social Security reforms to fund Social Security for 50 years. So if you were having a serious conversation about fiscal sustainability, you would hear discussions about, is it better or worse for working people, and for retirees to have a fully sound system? In 1986, when there was tax reform, it was bipartisan. In 1983, when there was Social Security reform, it was bipartisan. These hard conversations are very difficult to have on a one-sided basis. There have been examples. In 1993, there was not a bipartisan, a Democrat-led deficit reduction bill, but it did lead to the loss of control of the House because the election consequences were very immediate. That's why you need bipartisan solutions to hard problems.
Yeah. Remember several of those episodes firsthand. Anyone else to weigh in on this? I think I might point out parenthetically, Jack. I think when you left OMB, you left at least at the time of a surplus, and so it is possible to run a budget surplus, but it's been a while.
But I'll tell you something, Rich. One of the hardest things that I've been kind of accused of in the years is you could have spent more on our priorities. And we didn't, because we thought that having a fiscal policy that was sustainable was important. That can't be one-sided. It can't be that Democrats don't spend if Republicans cut taxes. I'm not a big fan of some of the spending that has happened in recent years, but there has to be a way of bringing it out of the starkly partisan debate and into how do we do this together to have a sustainable future.
Thank you. I think we're going to move on to the last two questions I'm going to pose to both Glenn and Jack, and I think both of you have touched on this a bit, but as they say on Capitol Hill, we'll give you a chance to, refine and extend your remarks. And so 30,000-foot question, what would responsible fiscal stewardship look like at this moment? I think that this group has made a pretty persuasive case that this is not what it would look like, but what would it look like? And what would be plausible alternatives? And Glenn, I'll ask you to lead off, drawing on what you've already said or anything else, and then we'll give Secretary Liu the last word in this segment.
Sure, thanks, Rich. I would start where Jack began earlier, which is a budget here and now or in the future is a story. And the story we need to remind the American people is that we do care about national priorities of defense and education and taking care of the least well-off among us. We cannot survive that budget under current law. And the simple mechanics would be if we could bring the deficit to GDP down to 3%, hopefully a glide path to lower, we'd be well on our way. What would it take to do that? One lesson from the 1983 Social Security reform that Jack mentioned is to have a gradual adjustment in fiscal policy. And I would think that it has two parts. One is that, at least from where I sit, spending is the principal long-term issue, particularly in the entitlement programs for Social Security and Medicare. But we also have a revenue issue, particularly in the short and medium run. And we need to be turning those dials over those periods. To do that also likely requires a different budget process. We're having two conversations, one among deficit scolds, like everybody I see on the screen, and one in the broad political process that seems to think it doesn't matter. And so we need a change in budget process, I think, that internalizes that. If we can do all of that, we will have the fiscal health that restores the priorities I think Americans deserve and want.
Thank you, Glenn. And then, as promised, Jack, the last word on this segment about what a Jack Liu fiscal framework would look like.
Yeah, I think that I offered my views in my interjection on the last segment, but I would just kind of underscore that budgets have to be based on facts and analysis, and the tendency in this debate to try and kind of wave away criticisms, even when conservative Republican senators ask questions about people who are being hurt. There's a talking point response that says it's just taking people who don't deserve benefits off of the rolls. It's not true. And you can say, I think we can't afford to cover everyone, but to say that they're all cheating it's just incorrect. And I hear it every day. And I know how hard the fight was to cover more people over the last 30 years. I have a lot of the scars to show for it. And to say things like, we just want to check on their income twice a year to make sure. Anyone who's qualified for income testing in a program like Medicaid knows that if you're able, if you're well educated, it can drive you to the point of just collapse to qualify. If you have to do it twice a year, what history shows us is people just go away. They say, I can't deal with it. That's not because of waste. That's because we're creating bureaucratic hassles that make it so that people who are well can't participate in what they're entitled to. A lot of the people who are in this category are right on the margin between able and disabled. They're working, but they have either mental or physical health problems. They have a lack of education and sophistication. And, I just, to hear it described as people cheating, it's just not true. There may be an example here and there. All programs have that. But I think we have more of it in terms of the way the tax code is managed than the way spending programs are managed. And at the same time that we're, quote, taking off the cheaters because of waste and abuse in Medicaid, we're dismantling the IRS so that there won't be any ability to oversee whether or not high-income individuals and corporations are reporting their income. And in a voluntary tax compliance system, that's a terrible thing to do. So, a budget debate has to be based on fact. You can agree or disagree on the merits, but this debate, to me, has been very distressing because it's avoided addressing the kind of core issues of who's going to be hurt. Which is not to say that you can avoid hurting people. I've defended a lot of budgets where there were cuts in things that I believed in, and people throw things at you, when you defend it. But that's better than pretending.
We do have some time if any of our other panelists would like to offer some perspectives on anything we've discussed today. We'll also have time for several questions from the audience. So any comments from Alex, Jennifer, or Natasha on anything here?
So this has been such a rich discussion. I guess to return to one of the considerations around the politics of all of this, one thing that I've been wondering about is if the significant cuts to our safety net programs proceed, will people be able to hold Congress accountable for them? We know right now that the polling suggests that they're very unpopular, but when these cuts, should they go into effect, actually start flowing down, it's going to be through states and in some cases local governments. It's states, for instance, that administer Medicaid programs in conjunction with the federal government. It's states that administer nutritional assistance programs. And so I worry about, if these cuts move forward, people being able to understand that the reason that they're going to have to pay more co-pays, the reason they're kicked off of coverage, the reason why their child can't get nutritional assistance that they need, is because of this bill, as opposed to changes at the state level or at the local level. So that's one piece of our federated system of social program delivery that I think intersects with whether or not people can actually hold Congress accountable for what they pass.
And I would add to that the timing of when these will go into effect, which is often a deliberate way to delay sufficiently so that that confusion is made even more striking.
Okay, we do have several, or at least I count 3 questions from the audience, so I will share them. The pretty interesting questions. One is for the panel. Anyone can take this, and I'll maybe add a little bit of my own to it. The question literally is, what would be the prospects for another Simpson-Bowles commission? I might add parenthetically, another outcome from a Simpson-Bowles-like commission. So would anyone like to take that and maybe begin by reminding the audience what Simpson-Bowles was in the first place?
I can start, Rich, if you like. I mean, Simpson-Bowles was an effort to bring bipartisan overall budget rationalization. You had a prominent Democrat and a prominent Republican leading it. It produced a set of ideas, did not get a serious hearing. I think the prospects in the current environment are actually pretty low, but that doesn't mean that outsiders shouldn't be pushing for that and shouldn't be throwing in ideas that it could be. The pieces aren't hard. It will have to make fundamental changes to Social Security, to Medicare, and to revenue relative to GDP. I mean, those are the dials that need to be turned. There are other smaller dials, but those are the large ones. Can it happen? I think there will be a discussion. It was already mentioned this: the social insurance trust funds will be exhausted. As an economist, it's not the exhaustion of a trust fund that's a trigger, but in politics, it's definitely a trigger. And I think the American people are getting dissatisfied. So adding to that are 2 very practical things. One is that national defense is likely to need to increase substantially, and interest payments relative to GDP are rising. And so I think this conversation will have to happen. Whether it's Simpson-Bowles, I can hope, but I'm not sure.
I would only add that the Simpson-Bowles framed ideas that were very helpful to the negotiations that didn't ultimately work between the Obama White House and Republican Speaker John Boehner. The reason it ultimately didn't work is that it called for more revenues than the Republicans were willing to embrace. It called for defense cuts that neither party were prepared to put into place. And on the spending side, in terms of entitlements, it was at a very general level. It didn't have the detailed policy, which is where the rubber hits the road. You know, the commission that has worked most effectively was the 1983 Social Security Commission.
And that was going to be my next question. So Jack, remind us about that. And
And
is that something that could be a model for the
what
present?
people need to remember about the Social Security Commission is there was a scheduled crisis in Social Security that was going to hit between elections. And a commission of really distinguished people, chaired by Alan Greenspan, was formed to try and come up with a solution so that when that deadline hit, there'd be a plan that could either be embraced or not. Behind the scenes, there was a negotiation between the then President Ronald Reagan and Speaker O'Neill, where the members of the commission knew that they were coming to a place that both sides could embrace. That involves a level of comedy and kind of back channel negotiation and invisible relationships that has to be recreated. I don't know that it exists today the same way it did then. There was literally one person, you know, former Social Security Commissioner Bob Ball, who was close to Dick Darman and close to the Speaker. He was trusted in both sides. You know, Dick Darman, the then senior budget advisor to Reagan, not OMB director at the time. So, you know, I hope that we get to the point where we can figure out how the parties can agree to schedule. It's about 9 years till Social Security Trust Fund runs out. And Glenn is totally right. As an economic matter, it's already a reserve that's being drawn down. You'll end up with the only solution being general revenue funding of Social Security to avoid a 30% cut in benefits, which is unthinkable. You should be having a debate about these things. That's like a bigger deal than taxes on tips and overtime. And it's certainly a bigger deal than taxing Social Security benefit for upper income retirees. So we're not having a serious budget debate now. A commission can only help if the parties want it to help.
And can I just add one thing to this conversation? So I agree with everything that Glenn and Jack just said. And I think I too, as you look, and again, many more political experts than I on this, but as you look at like the constellation of the policy conversations that are happening, something that I worry about is that it just feels like a bunch of these trust fund expirations that we've been talking about, we're talking about 2031, 2032, 2033. I feel like there's no real urgency that is pushing in the direction of some of the conversations that Jack is rightfully calling for. And that's really problematic from a fiscal perspective because, you know, you're not like in a fiscal crisis until you're in one. And then when you're in one, you're kind of trying to sort your way through a moment like the UK faced with Liz Truss, and like, what are the policy options and toolkits available to you if you haven't yet worked to develop them, is something that I really worry about. My hope and aspiration, though maybe this is overly optimistic, is that some of what Glenn was describing with respect to what interest rate dynamics are looking like already today, like where the 10-year is presently, it's splitting with 4.5, but it's also that the 10-year market implied forward right now is something like 5.4, 5.5. So like the interest rate environment is just going to push us to have some of these conversations, I hope. And in that sense, like maybe you give yourself space to do the work of coming up with the right toolkit that invariably is going to be a less politically popular toolkit than this like Oprah-like approach of like no taxes on this and no taxes on that.
And the 20-year bond auction had thin demand, which for those of us who follow Treasury auctions is a scary thing. You want every maturity to have deep demand to maintain the stability and strength of the U.S. Position.
Yeah, one thing I might add, just that is relevant to connecting the two different eras we've discussed, is obviously the level of debt to GDP is now much higher than it was back in the late 80s, early 90s. But interest rates were a lot higher then as well. So if you look at debt service costs relative to government outlays, they're basically either at or very soon will be at the level that triggered bipartisan agreement, then simply because folks felt they didn't have a choice. And so that the other dynamic of interest rates is when they get to this level, they do start to really start to squeeze things.
And when you combine rate and stock, the fact that we're paying more interest on the debt than we are for national defense is kind of shocking.
Indeed. Well, we actually have we have 3 minutes left, and we have one more question from the group, which is pretty technical, but from the audience. But since it was, I will ask it of you, and I think one of you already mentioned it briefly. So the question is, Section 899, among other things, withdraws some of the benefits extended to sovereign investors of the existing Internal Revenue Code. Do you think this stems from a need to offset some of the steep tax cuts? In other words, to raise revenue, or are there other concerns driving? And maybe a meta question, is this something that survives into the final bill? Because there is a lot and growing opposition to it that I've become aware of. So Glenn, I think it was you or someone.
I don't think it will survive the final bill, because I think the opposition from the financial community is very, very large. I mean, basically, I'm oversimplifying, but it says we will effectively impose a tax on inbound investment from countries who are doing things we don't like. And the things we don't like include digital services taxes, adherence to global minimum taxes, and you can argue about the merits of those, but we've never had that kind of capital discrimination before. And I think that would be a very, very bad idea. It's not enough revenue to make it material, and it contains enormous risks. That it got in there at all has me worried about the horsepower in the design of this bill.
Yeah, I agree with Glenn on the analysis of it, but I think the impetus for it is in part a sense that other jurisdictions, particularly Europe, are finding ways to tax what we would consider American income. And this was already an issue 10 years ago. It really is a reason why we need to have real tax reform, normalize our tax code and the global system, and do it in a way where we follow through and legislate after we reach agreements. We're in a pretty unsustainable place in terms of the way we compete with not just adversaries, but friends in the case of Europe.
Anybody else? We have about half a minute left, so I'll give someone the chance to offer the last word if you'd like to.
I don't have to offer the last word. Well, maybe I will, just because what Jack is describing, the Biden administration spent years trying to negotiate an international tax deal to prevent races to the bottom. And in part, what this measure 899 is about is it's the administration's attempt to kind of undermine the fact that the rest of the world has moved without us with respect to actually implementing against that incredibly important objective. And the one thing I want to say about this package, and I think it's been super interesting, this conversation, because there is a lot of political differences on this Zoom, and yet a fair bit of agreement on the nature of both the consequences of the bill and also the fact that many of its core principles with respect to not thinking seriously about tax reform with respect to distribution are fundamentally misguided. And so I don't necessarily know if I share Glenn's optimism that some of this stuff is going to fall out of the package. And I think Alex also had some optimism with respect to these cuts to the social safety net programs. I suspect that part of what you're seeing is that there is this really intense push to move this bill as quickly as it can because of the, if it's fish that stays out too long, it starts to smell. And so I bet what we're going to see, and I guess time will tell, is there's going to be some tension between trying to get this done quickly and trying to get some of these very clearly identified flaws in the bill addressed. And I ultimately wonder where that all is going to land, but I hope it lands in the direction of a package that's both more fiscally sustainable and less painful for households.
Thank you, Natasha. And that brings us to the end of our webinar. I was happy to see this happen and even happier to be asked to moderate it. So on behalf of SIPA, Alex, Jennifer, Glenn, Jack, and Natasha, thank you very much. Perhaps we can do another one after the bill passes and we know exactly what's in it. But with that, we are concluded for the day, and enjoy the rest of your afternoon. Thank you.
Thank you, Rich.
Thank you so much.
Thank you.